On average, we probably transfer at least 2 students per day. So we actually go through our transportation department, which is Karen Wright, and she coordinates a pool of drivers, coordinates who will take our students to the appointments. And then we actually have 2 new employees that are part-time employees that share the workload in a week. And they are health center assistants that will actually go with the students to each appointment. So one of the things that people may not realize is that I'm actually not a nurse. I'm administrative support for our nurses. And therefore, I do a lot of coordinating at the health center, the health center coordinator. And what that means is basically if the nurses need food for students, I will go and run and get the food from the dining hall for the students. If there's laundry that needs to be done, I can help out with that. Or when it gets so bad, we can't do enough of laundry in our washer and dryer, we actually coordinate with facilities, and they're able to help us with the bigger washers and dryers. So there's a lot of things that go into helping out when the flu hits. We also make sure that we cover each other with having students put on Socrates, so all the faculty members are aware and teachers know where the students are, as well as reach. And then any appointments that may need to be coordinated, certainly we can go about doing that as well. Sometimes it does get to be long hours. I do have 2 kids of my own as well as a husband. So I do try to help out whenever possible with staying over, and usually I have, I'm very fortunate, I have parents that live by, so they're able to go and get my kids off the bus until I'm able to get home.
I was actually a stay-at-home mom for about 5 years before I came here, but prior to that, I worked at St. George's Tech High School.
If you had a morning shift, what time would you wake up in the morning?
At 6, like in the morning.
And how long are shifts?
Roughly 12 hours. Friday night shift is 16 hours and Saturday day shift is 14 hours. If I worked in the morning, I leave at 7:30 p.m. to 8 p.m. But if I came in for night shift, they usually leave at 9 in the morning.
How many kids come in to pick up meds every morning?
35, I think.
How many kids on average come in sick every day?
During the flu, we were like seeing about 130 to 150 students, but that also mixes in with the students that were taking medications. Like on the weekends, I see less because I usually work Saturdays. But on average, like on a regular day, I'd say probably about 30.
What was the experience like when you were working during the flu boom?
Very busy. Very busy, and all the nurses, we all banded together and picked up extra shifts so there could be at least 2 nurses on, because there are a lot of sick students coming in. There are plenty of sick students to be taken care of, as well as everyone that was coming in for medication. Actually, it's a really good fit for me. I have 3 children, and so since I usually work Saturdays, it allows me to be like home with them.
And where were you working before you came to St. Andrews?
I was doing home health for Connections.
And what do you love the most about working at St. Andrews?
The one thing I love the most is helping others, whether it be a student, faculty member, or co-worker. Whatever the question or need is, I'm always willing to help whenever I can.
I like working with the students a lot. I'm pretty new here. I've only been here about a month. So I would have to say it's definitely the kids. I love working with the high school kids age. I have 2 high schoolers at home. It's just like an easy fit to fit in with high schoolers.